Again, welcome. This is the information session on the PhD in Health Economics and Outcomes Research in the Choice Institute and the Department of Pharmacy at the University of Washington in Seattle. I'm joined by my colleagues here, and they'll introduce themselves. But let me start with me. I'm Anirban Basu. I'm a professor of health economics and the director of Choice. And my research interest spans health econometrics, cost effectiveness analysis, and program evaluation, which is some of the key kind of specialization within the institute. And I'll let my colleagues here who's joining introduce themselves.
I
Josh?
can go first. Hi, everyone. Josh Carlson. I'm a professor in the Choice Institute and the graduate program director. My research interests are primarily in the area of economic analysis, cost effectiveness alongside clinical trials, and some work in outcomes-based contracting. And I can turn it over to Ron.
Hi, everyone. I'm Ronald Dickerson, fifth-year PhD student, as well as a student rep on the PhD student committee. So welcome, everyone.
Good morning, everyone. Yeah, I'm Marina. I'm the graduate program manager for the Choice Institute. So I'm the primary staff person that you would be interacting with should you choose to apply to our program. So welcome. We've got a nice program scheduled for you here today, and happy to have you here.
Thanks all. So for today's agenda, as you can see, I'm going to briefly talk about the Choice Institute in general. Then I'll turn it over to Josh, who's going to talk about the PhD program structure, and then Marina about the application process. And they'll have question and answer at the end. If you have questions, feel free to type it in the chat, but also unmute yourself or raise a hand to ask questions. We'll be happy to answer any questions you might have. All right, next slide. This slide kind of shows some of the Choice leadership. You've met me. I'm also kind of assisted by the Associate Director of Choice, Dr. Jing Li, and she's an associate professor and also a specialist in health economics, especially in aging and dementia space. You have met Dr. Carlson, who is the director of the graduate studies. Dr. Douglas Barthold is an associate director of graduate studies and also a health economist and an associate professor. You've met Marina here, Marina Gano, but also we have another staff member, Ms. Liana De La Torre, who oversees our online certificate programs. And also interact with our PhD students because they often end up TAing for those certificate programs. Next slide. So as you may already know, the Choice Institute in the University of Washington is a global leader in generating knowledge to improve individual and population health. And we do this through transformative learning, research, and dissemination, around the effectiveness, safety, and most importantly, the value of medical product, services, and policy. So we span almost every aspect of medical technology interventions and programs, especially focused in US healthcare, but also sometimes in global health too, in understanding all these aspects of our healthcare systems. Next slide. We have three missions, as typical of most academic research institutions. Obviously, that involves research, training, and service. We have as you can see, as we go along, a very well-developed, well-established, long training portfolio of students with a very large and well-connected and engaged alumni network. And many of you who would join would become a part of that. Next slide. Just a brief history of the program. This year is the 30th anniversary of the program. The original program was developed by Andy Stagachis, who joined UW School of Pharmacy, and he recruited very famous health economist Sean Sullivan to the group, who was still a professor with us. and it's quite active, and it's working quite a bit on the IRA policies of drug negotiation or price negotiation. And both of them established the Pharmaceutical Outcomes Program in 1991, and then in 1995, and then in 1996, the first PhD cohort was admitted. And then around 2014, 2015, the new leadership emerges. Dr. Sullivan became the dean of the school, and I moved to become the director of the PORP. And we transitioned the program to an actual formal institute, given the breadth and the depth of the work that was going on across all the faculty. And then since then, we have hired several new faculties, and I'm going to show quite a bit in a future slide. Next slide. Here is our core faculty. We have 4 assistant professors, 3 associate professors, about 7 full professors, and we have 2 emeritus professors, and you might actually know their name, Lou Garrison and Beth Devine, very well established HEOR researchers in the field. Dr. Devine is the incoming president-elect of ISPOR. And both of them are highly active with the students, attends our seminars, and engage with the students. So they are emeritus just for the sake of the name itself. And I'll talk about some of the specialization for these professors and the type of work we do in the later slide. But as you can see, it's a medium size, but also complementary kind of expertise professors who kind of spans all aspects of healthcare evaluation and policies. It's also a great faculty to student ratio for our program. Across all the years, we have about 20 PhD students in any given year, and we admit about 2 to 3 students every year. And so you get a lot of kind of attention across from various faculty while you're here. Next slide. Here is our staff. As I said, Liana De La Torre is our online certificate program manager. Marina Gano is kind of the engine of the program. If you come here, you will interact with her regularly, and she actually overlooks every aspect of the graduate program and the institute. And we have senior research scientist staff who mostly do research with faculty on the grants work and other stuff. Greg Gazaskas and Linda Liu. Next slide. Besides our core faculty, we have a very large cadre of adjunct and affiliate faculty. Adjunct faculty are professors who are at UW but in different departments, and affiliate faculty are professionals who are outside of UW. And these people are not just adjunct or affiliate for namesake only. To become adjunct and affiliate, they need to demonstrate a continuous engagement with our program. And they do so by mentoring students, by giving lectures in our class, and providing opportunities for our students for various kind of sometimes internships, sometimes in other opportunities. Next slide. A question that we often get from our incoming PhD students is that where do our students go after they graduate from their PhD program? Typically, over the last 20 years, 1/3 of our students have gone to academia, and as you can see, some of the names and where they are placed. 1/3 have gone to industry, and the 1/3 have gone to more research organization like Gates Foundations and other stuff. And this is a mix that has remained kind of stable over time. And again, it's not something that you plan ahead that I will go here. You come here, and often your preference change and you shift to understand. You thought you'll go to the industry, and suddenly you love academia and you want to stay, and vice versa. But this is just to show that all 3 paths are open after you get a PhD in this field. Next slide. Here is kind of portfolio of our current students. And obviously, we have given the name and the pictures, but one thing we have committed to for many years now, and if you can see on our website, our mission statement and our diversity statement, that we do value diversity quite a bit, not just diversity of how they look, but are their thoughts, where they come from, the background they're coming from. And also we kind of do promote a strong culture of inclusivity in our program. Students participate in most of our decision making, including the admissions committee. As you can see, Ron is a participation of that. We have a curriculum committee and various forms of committee. And Josh is going to talk a lot more about that probably later on. But we do value a very inclusive and kind of intellectual environment that would promote really growth and healthy learning. Next slide. Here are some of our recent graduates. Zizi LCC, her dissertation was evaluating the Medicaid subscription-based payment model in hepatitis C, and she became a data scientist in Value Analytics Lab. Felipe Montano Campos studied really a very economically theoretical approach of private choices in public health, a framework for economic epidemiologic model of infectious disease, really bringing in behavior in epidemiologic models. He has ended up as a postdoc at USC. And then Ashley Thaba, who did understanding the outpatient medication use and spending among impaired older adults, and she ended up as a associate director in the BioNTech pharmaceutical company. So as you can see, the spread of different kind of types of organization that our students go to even in 1 year. Next slide. As I said, our commitment, this is, if you're interested, please go and take a look at our commitment to diversity, equity, and inclusion. I think it is more important that we double down on these aspects during these times. It's not about, specific community or specific type of people. It's about general population level inclusivity and acceptance, and kind of building a culture of debate. I mean, we are a scientific enterprise, but also doing that in a respectful manner and inclusive manner. We actually invoke this for every decision we make. For example, when we are hiring new faculty, we kind of make sure our committee members go through this and understand what we are trying to achieve, our student hirings, and all other decisions that we make at the institute level. Next slide. Here are our areas of research. We can broadly categorize our specialization in health economics, both theory and applications, and this includes both like applied microeconomics and other foundations, and econometrics and statistics, and obviously related applications for that. Outcomes research that includes large observational claims data methods, pharmacoepidemiology to some extent, but also in general observational data research and their applications, and a broad cadre of policy evaluation, including cost effectiveness analysis, other economic evaluations, and a host of causal inference methods that are applied to policy evaluations in the space. So we cover all of that. Next slide. Here are certain our faculty's current research portfolio. As you can see, it kind of ranges from more decision sciences using VOI, model development, to data science, more machine learning, and other aspects of predictions, and more health economics, including health equity research and infectious disease modeling. Okay. We have several databases in-house, so our students have access and certain opportunities to actually directly access them and work with these data for your dissertation. This includes the Merative Market Scan, which is one of the largest commercial claims encounters databases for employer-sponsored insurance, and some Medicaid managed care. We have 15 most recent years. We have a very strong collaborations with our local organization called Truveta that have electronic medical records from large 31 healthcare systems. We currently have also access the Komodo Health Map, and this actually is another large claims data that covers almost 250 million people in the United States at any given year, and we have really detailed data on mortality and zip code level on that, going from 2015 to current, and all of these data gets updated, every year. And then more recently, we got access to the Epic Cosmos data, which is, as you know, Epic is one of the largest IT system used for majority of healthcare systems in the United States. And so because UW has started to contribute data to that Epic database, we would have access to all Epic data across the country for all the EMRs. So that's also available. So this kind of gives a broad ideas about all the fun stuff you could do when you have data at hand. Thanks. To learn more about our program, the students, what they're doing, the faculty, what they're doing, the type of research going on, what our alumni are doing, and how they're engaged with us, I would highly urge you to go and see our latest annual report. It's a 30-year version, so it's a little bit more detailed. You'll also get to learn about the history of the program. So I would highly encourage you to do so. Okay. So with that, I am going to turn it over to Josh.
Great. Thanks, Anirban. That was an excellent overview of the Institute, all the different things that the faculty and the students are getting up to. So I'm going to take some time just to talk about the PhD program specifically. So the PhD program is really one of the top-notch training programs in health economics and outcomes research in the country. And we don't have, basically, we focus on the pharmaceutical sector, but the training that we provide is really can be applied to health technologies in general, as well as different types of program evaluation, policy evaluation, et cetera. We have at any given time about 20 to 25 students, including majority PhD students who are here with us for typically 4 to 5 years. And then we also have a master's program where we have between 4 and 8 master's students who come in and spend about a year with us, and then they go and spend the second year with an industry sponsor. So we have between 4 and 8 master's students as part of the sort of local graduate program in any given year. You can go on to the next slide. So we cover a number of different fields of study. Some of these classes we teach, some of these classes we leverage the excellent teaching programs that exist within our complementary departments, like those in biostats and epidemiology. We also teach health economics, decision sciences, clinical trial design, health policy, and data science. And other subcategories of these as well. But these are the primary ones that we cover in our core program. Next slide. So our core program has 4 primary elements. One is a set of core courses. These are ones that everybody takes, and they provide the really fundamental and core training that we require to basically get up to a sufficient competency in the field in general, but also prepare you to do a dissertation. It's supplemented by electives. We have a requirement for a certain number of electives. People can take more than that requirement, but there are electives, and that gives you some flexibility to focus in on areas that are specifically of interest to yourself, as well as see what else is out there and anything that might spark additional interests. There's 2 seminars that are core to our program. There are other seminars that are offered at the UW and in the health sciences in general. Those are also a requirement of the program. And we have a weekly seminar that is part of the program where we require students to be there throughout their time with us. And that's really a central point where we come together, listen to research talks or more hands-on related talks, but also get to connect as a group weekly and get updates on the program and see each other in person. Finally, there's independent research. There's an independent research requirement. That's where you spend time one-on-one with a faculty member and work on a project that you mutually decide is of interest, and you get some credits for doing so. There's a minimum number of credits that we require to be achieved through that process. And finally, there's the dissertation. So that is essentially your large project that you're working towards. That usually is done from years 3 until you're done with that process. And really culminates, the program culminates with the completion of that dissertation. Go on to the next slide. So here's how the credits break out in some specific classes for the core program. And again, these focus on epidemiology, biostatistics. We have the HEOR courses are ones that we specifically teach and provide. So we have a core set of classes that we provide in policy analysis, pharmacoepidemiology, economic evaluation, and some advanced methods therein. Health economics is another core component to what we do. And then we have a couple health services classes that deal with methods in health services and dealing with large data sets and databases, survival, data analysis in biostats again, and then some of those other components that I spoke of, the seminar. We have a requirement for attending both of those seminars at different times, and then credits related to dissertation electives and independent study. Go on. We also have a data science degree option. This is a program that we developed more recently where students can choose to focus in specifically on data science and get an actual line item on their CV and on their transcript, noting that they focused on data science. And what it takes is basically completing a 14 credit set of specific electives as a supplement to the core programming. So that component that has the electives and required electives, you essentially use that course as well as supplementing a couple extra credits to complete this program, focusing on some additional courses relevant to data science specifically. And then you get this as part of your degree. You essentially just declare that you're attempting to do this, and then that gets registered and provided prior or as part of the graduation process. Let's see, I think that's it. So here is a sense of how the program works in terms of progression through the program. So in the first and second year, you're really coming and you're focusing on completing the core courses and doing what we call preliminary examinations. So these are exams at the end of the first and second year, which test sort of your core competencies in the field. And you also in that time begin to sort of think about areas of interest for dissertation topics. You're typically not going to be too far down that road, but you're really just trying to meet with different faculty, take class projects to explore different methods, all of these kind of things to try and think about what is the topic area, what are the methods that I like, how do I sort of bring this down into a dissertation topic that might be of interest to me and that might be feasible. The summer quarter after the second year is when you dive into that a little bit more specifically. People vary a little bit in their timing there, but that's really the kind of transition year, because after the second year, you've typically completed all of your prelim exams and the bulk of your core courses. So that second year, that summer is when you begin to transition. Okay, now I have a little bit more flexibility and I want to focus on the dissertation and developing those ideas. The process there is to identify a core faculty member that you're going to be working with, develop a short proposal that gets reviewed by all of the faculty, and then from there you develop a long proposal which is basically your plan for your entire dissertation, and you defend that long proposal as part of what's called a general exam. And that exam differentiates from the preliminary exam. The general exam, you basically have a written exam and an oral exam that focuses on whether you have the skills and the training to do the work that you are proposing to do. So it's very focused on your dissertation. It's one of the big landmarks in your progression. Once you're over that, then it's really just about focusing on completing that dissertation, and then at the end of that, you defend their dissertation, and that typically happens in the 4th year or the 5th year, depending on your overall progress. I think that covers most of this progression-related stuff. So we can turn it over to the application process itself. And I think, Marina, you're going to talk about the application process. And then again, we'll have time at the end to do questions and answers about anything that either Anirban or myself or Marina will be speaking to. So turn it over to you, Marina.
Great, thank you. So now I'm going to get a little bit more into the nitty-gritty of application process. So our timeline, I'll start from the application deadline, which is December 15th. So that is when we would expect all applicants to have all materials in, including letters of recommendation. After December 15th, we would distribute the applications to the members of our admissions committee, which is generally 4 to 5 faculty in the program and 1 student member, who this year is Ron. And then by early January 2026, we will notify those who have been selected for a first round interview. And we have 2 rounds of interviews that happened in January. So the first round is going to be a smaller panel, generally of 2 members of the admissions committee. And then we would convene again and narrow down our final candidates to a smaller number. And we would hold a second round interview at the end of January, where we provide an opportunity for the candidates to meet faculty beyond the admissions committee and interact with our students as well. That is all held virtually via Zoom. By mid-February, we would provide offers to the program. And I did not include in here, but we do have a admitted student day, generally at the beginning of March, where we fly out our admitted students to the campus to get to know, what it's like to be a student here, kind of to help inform your decision as to whether or not you would be accepting the offer of admission, which there is an acceptance deadline of April 15th. And then the program starts in late September. The University of Washington is on a quarter system, so we start a bit later and end a bit later than some of the semester schools in the US. As far as prerequisites for applying to our program, there are general graduate school minimum requirements for admission. The graduate school minimum requirements would be to have at least a bachelor's degree or equivalent of a bachelor's degree if from a school outside of the US. But as far as our program, typical academic backgrounds of competitive candidates would be students coming in with a master's degree in relevant fields such as epidemiology, economics, statistics, public health. Those are just some examples. We definitely see applicants from all sorts of academic backgrounds, but those are some examples there. And then we also welcome applications from students with professional degrees in pharmacy, medicine, or other health-related fields who also bring with them strong quantitative skills. Some other prerequisites would be to meet the minimum graduate school requirements, like I mentioned, and one of those is a minimum grade point average of a 3.0. That's on a 4-point US scale. And in our program, we do find that more competitive applicants are going to be coming in with a GPA of a 3.5 and above. Next, we do require the GRE for all applicants. We don't offer waivers for that. So if you have not taken the GRE and you are planning to apply to our program, please schedule an exam because we are not able to waive that requirement. Lastly, we do follow the Graduate School Policy 3.2, which is for demonstration of English proficiency for non-native English speakers. And I'll talk a little bit more about that in this slide. I get a lot of questions about this, so I wanted to do a little bit of a deep dive here. So English language proficiency, it's required for graduate study at University of Washington. And there are multiple ways where you can fulfill that requirement. The kind of the most common question I get is regarding TOEFL scores. So English proficiency test scores, TOEFL, IELTS, or Duolingo are all accepted. I have on here what the minimum scores for our program are. And other ways to demonstrate English proficiency would be to have a bachelor's, master's, or doctoral degree from a US school where English is the medium of instruction. Alternatively, a bachelor's, master's, or doctoral degree from an institution in this list of countries that the graduate school has identified in their policy where English is the medium of instruction. Or if English is the medium of instruction of where you have received your degree, there is a way to submit either a letter or a transcript that clearly states medium of instruction is English, and that can fulfill the requirement as well. These questions about English proficiency can be pretty specific to each applicant. So if you're not sure how you would meet this requirement, I have our email addresses at the end of the slides here. You can certainly send me an email and I can let you know how you could meet that requirement. Next, I'm going to talk about the considerations that we use when evaluating prospective doctoral students. We use a holistic admissions rubric. So we don't have cutoff scores or anything like that. We evaluate each aspect of your experience and your application holistically and all equally weighted. So those would include a strong record of academic achievement, prior experience working in fields related to and or applicable to HEOR, leadership experience, demonstrated interest in HEOR, communication skills, so verbally and in writing, and ability to contribute to the choice program's learning environment, including diversity, which we define quite broadly. And here are just samples of kind of where can we glean information on how you would fulfill those aspects of our rubric. So I'm not going to read through all of these, but they can be anything from, conference attendance and work experience, letters of recommendation, and so on. So we really evaluate your application as a whole package. So we encourage you to include anything that you think showcases what sets you apart as an applicant when applying to our program. And just to kind of be very transparent, this is how in practice the evaluation process looks. So this is the actual rubric that we do provide our committee members. So it's just another way to view the past two slides. As far as some application tips, we recommend contacting your recommenders early. So now, if you are planning to apply this year, please reach out to your recommenders. That is certainly one of the main things that can hold up our applicants is not getting all of their recommendations in on time. So please give your recommenders as much time as possible to submit the request. When you're filling out the application online, you have the option to designate up to 3 recommenders. And once you enter them into the application with their name and their email, they'll receive a invitation via email to fill out a form and upload a letter of recommendation. Please submit a strong, focused, and well-edited CV. Things you can highlight in your CV would be your research skills, data analysis and quantitative skills, any relevant training experiences, electives you've taken, courses, presentations, as well as any leadership experience. Definitely highlight any projects that are relevant to HEOR and include any publications you've contributed to, even if not yet in press, and it's helpful to link to papers when you're able. As far as how to apply, we have all applicants apply directly through the University of Washington Graduate School, which is an online application. I won't go through this step by step, but there's an online portal. We select Start Graduate Application. The application type is graduate. And then we do have a master's program, so make sure that you are selecting the PhD program when you are applying. And then the quarter and year would be fall 2026. We don't accept any mailed application materials. That's not as much of an issue as it used to be, but just so you're aware, you don't need to mail me anything. Unofficial transcripts are sufficient for the application process. It would just be uploading scans of unofficial transcripts into the application portal. And only if offered admission will you be asked to submit official transcripts. And lastly, late applications are not accepted. So the application does close down. It's at 11:59 p.m. Pacific time on December 15th. As far as the application fee, it is $90. And the fee waiver process is administered through the graduate school. And there's information here on how to acquire an application fee waiver. And the last I checked, unfortunately, international students are not eligible for the fee waivers. But for more information, you can look here on the graduate school website, and they need to be submitted at least 7 days before the deadline. Here are some frequently asked questions that we tend to get from applicants. As far as funding for our program, for our program, we guarantee funding for the first 2 years. And what that means is that starting in the 3rd year, the responsibility of obtaining funding shifts to the student, but that does not mean that we are not actively supporting you and helping you in seeking out opportunities and helping you find funding. But starting in year 3, we do expect our students to take a more active role in seeking out funding opportunities, kind of on the pathway to independence is what we call it. So that is how we handle funding. Most of our students are funded on either fellowships, research assistant positions, teaching, or graduate staff positions. They are 50% FTE is what you need to obtain a full tuition waiver. The current stipend is listed here, $3,449. And we do also get questions from students whether they can supplement those positions with other work, like external work, or other positions at UW. Generally, that's fine, but it's something that you would balance with your workload and academic progress. And the funding positions at the UW do include health insurance. Waiving required courses. We do have a mechanism for waiving courses. This tends to come up, say a student has a master's of public health in epidemiology from a different school, and they look at our program of study and see that there are a 2-course series of epidemiology as required courses, but they've taken very similar courses in their master's degree. There is a process if a student wishes to waive those. In general, though, we do find that students it's beneficial to retake those courses as they're often, presented through different lens, different instructor, but there is a mechanism for waiving required courses. As far as job outcomes for after graduation, Anirban and Josh spoke a little bit about this, but in general, we've been seeing that it's about a third of academia, industry, and then government or nonprofit organizations. Our program is STEM designated. Get that question a lot, which means that students would be eligible for the STEM OPT extension. Lastly, just re-emphasizing that the GRE cannot be waived and the scores must be valid, so no more than 5 years old. Okay, so I see there's been some questions in the chat.
I have answered most of them, but Marina, maybe you can answer the last question.
Okay.
When should application fees and GRE scores be submitted?
Okay. Yeah, so application fees and GRE scores, that would be submitted by the deadline, so December 15th.
Let me see. Anirban, are we going? I know there's a lot of questions here that have come up.
Yeah, I'm trying to write the answers to them. One of the thing, Marina, you mentioned the question was can the application fee waived? I know it cannot be waived for international students, but for citizens, is there a way that waiver is possible?
Yes, there's you request a waiver through the graduate school, and it's based on the Washington State Need Grant salary thresholds. So yeah.
So it's not in our hands, but it is possible. One comment here was also around do international students have to pay anything in terms of tuition and stuff like that? So essentially when you're funded, that is covering tuition and a stipend. There are a couple ancillary fees that come up that we cannot specifically pay. We guarantee 2 years of funding, and then we work with our students their entire time here to maintain that funding, but the responsibility does shift. So it's a nuanced answer, which is just to say that at some point you're getting positions, the responsibility falls to you. Now we're historically been able to fund our students and find positions for them. It's something we take very seriously, but you should note that responsibility does change in the 3rd year.
Yeah.
There was one question about what's the difference between our program and the PhD in health services.
Yeah. So I can take that. So I was in the health services program before I moved over. The health services program, there are a lot of overlap in the courses that our students take and the health services PhD students take. However, our program is more oriented toward health economics or the economics field. The health services program is more featuring sociology and organizational behavior and more general health services stuff. Focused around some population health dynamics. What's interesting is that the methods part of it, and I teach actually the core course and the methods that in both the program. Many of our students jointly take both those programs, but ours is more focused around economics, and theirs are more of other social sciences kind of focus.
I'm going to answer one question, then Phyllis, I see your hand up, so I'm going to come to you specifically in a second. But first, I'm going to take a question about supervisors, reaching out to them, whether they're required. So it is not required that you reach out to supervisors and have somebody sort of agree to take you on in their lab or in their group. That is different than some other universities in how they do it. We do not require that. Ours is a general application process. So we look at each individual, we interview all of them. Once you're accepted into the program, then we assign initially an academic advisor, and then you work to find a dissertation chair later on in the program. So that's not a requirement. You can feel free to reach out to faculty members, but that's not necessarily a requirement either. You will get through the interview process that we have and the application process. There will be opportunities to engage with most faculty members. There's multiple tiers of discussions. So as you work your way through the interview process towards entering the program, you will have an opportunity to speak with almost every faculty member of record. So that will happen as part of the process as well. So it's not something that you have to do prior to application or as a requirement to apply to the program. So a question about, for non-native English speakers that have a master's degree from an English-speaking country, do they have to provide proof of English proficiency? So if you have a master's from an institution that where the instruction is in English and that's verifiable, then the English proficiency is not required. Marina, did I say that correctly?
Yeah, that's correct.
Thank you.
It's kind of confusing because a degree from an institution where English is the medium of instruction is one of the 4 ways you can meet the requirement. So we do need to verify that this was indeed the medium of instruction, but you would not need to submit test scores.
Right.
There's a question on is WES evaluation a requirement? I'm not sure what WES evaluation is.
It's a WES evaluation.
Wow.
I think it's World Education Services International Credential Evaluation.
Ah,
No, we don't.
okay.
We don't require them, but if you have one for your degree, it's always helpful to include in the transcripts that you upload, since it can help our faculty who maybe aren't familiar with your school's grading system, just to see that, but it's not
I think
required.
that's great, because there was another question from someone who has an MBA from UK, but that doesn't provide GPA, but rather graduate with distinction. I think the WES evaluation would really help in that sense. Okay.
Can I put Ron, can I put you on the spot here, just since you are a current student in the program? I guess I don't have a specific question, but do you have anything to say about, why you chose our program compared to others, or kind of what highlights of your experience has been through the PhD
Absolutely.
program at Choice?
Yeah, I mean, it's a prominent degree program. We're all renowned researchers, and also, extremely inclusive. Our students engage in a number of different topics: health economics, research, pharmacoepi, decision modeling. I think we integrate that, well, and also, feed off of each other. And so, we got a strong peer community, as well as, strong relationships with the faculty. And so I think that's one of or many of the highlights of the program and why I chose Choice.
Thanks, Ron.
And Ron he'll actually be, I think, the first student to earn the data science degree option. So sounds like you've had a good experience with that as well.
Absolutely. And, just to speak on that, you build a lot of skills in sort of course, programming, where you learn things like design best practices, of course, machine learning, data visualization, where, you really get a really foundational understanding of how to, display quantitative information. And then, the capstone at the end, where you integrate all 3 of the previous courses and its applications to HEOR. So really cool data science sort of degree option that builds alongside, your HEOR, research as well as coursework. So, yeah.
Great. There's a question from Larry about feasibility of student involvement and internships and research opportunities outside the university. So we have lots of opportunities. Our students engage in lots of activities external to UW. We have many of our students will do internships. So we every year we have basically a large group of alumni, and we have what's called a corporate advisory board, which is basically heads of HEOR at different large biopharmaceutical and medical technology companies. So we basically canvass that group for internship opportunities, and then we share those with all of our students. So in any given year, our PhD students. Typically between the first and second and third is when the emphasis is, but at any time, many of them are doing internships with some of those groups. We also have connections, groups like PATH, Gates, clearly those are local. So we have alumni who are there, we have individuals who are working with them. Sometimes they're funded with a full RA, sometimes it's a quarter position or something like that. So there's opportunities to work with those groups as well. We have connections to Tufts and some of the faculty there. They have the way that our students, I mean, it's theoretically possible to work with them, and anybody who is an affiliate or an adjunct can be on committees as well. We can work through a process with that. Your chair needs to be here, but you can work as a committee member through that. And what's the other question? So I think I answered most of those things. So the short answer is yes, all of those are possible and frequently done by our students. Any other questions? I think gone through and answered most of them either verbally or in written format here. Last chance. Who's got a question?
Someone who that has a national diploma and higher national diploma apply for a PhD? Usually, typically, most of our admin students have a master's degree. And not just bachelor's. Yeah.
Okay. Well, I think we are about at time. We can go ahead and wrap up now. So here's our contact information. This has been recorded, so this information you can go back to and share, and revisit. You can also reach out to us with questions, and we look forward to seeing your applications. We had one question right there at the end.
Yeah.
Is there an alternative for the GRE? Unfortunately, there is not an alternative for the GRE. It is our requirement. Okay. All right.
Thanks.
Thank you,
Take care, everyone.
everyone.
Bye.